Anadrol, a very potent oral anabolic steroid. It is considered by many users to be the most powerful steroid for adding size in the shortest amount of time. It is not just popular among bodybuilders, but is also commonly used in strength sports like powerlifting. Anadrol also has a unique actions in the body, which make it an interesting compound. So, in this video, I will break down everything about Anadrol, its history, medical uses, and unique properties, like its half-life and mechanism of action. We'll also dive into how Anadrol is used in bodybuilding and other sports, as Anadrol can have many applications. And of course, we will cover its dosages, benefits, and side effects. So, whether you are an experienced user, a bodybuilder, or a strength athlete, or just curious about this interesting and powerful compound, this video will cover everything you need to know about Anadrol. And now, let's start with the history and medical usage of Anadrol. Anadrol, or Anadrol 50, is the brand name, and it is called Anadrol 50 because 50 mg is the most common dosage for its supply, while the chemical or generic name is Oxymetholone. Oxymetholone was first described in 1959 and released in the US as a prescription drug in 1960. Oxymetholone was used for various medical purposes. These included rebuilding muscle mass lost due to surgeries, accidents, chronic infections, or general catabolic conditions. It was also used to treat osteoporosis. In 1970, the FDA narrowed its medical usage to treat anemia, which is a condition caused by a deficiency in red blood cells production. In general, all anabolic androgenic steroids can cause an increase in red blood cells production. However, with oxymetholone, this effect is much more pronounced. Therefore, the FDA later approved the drug to treat HIV patients, as they often suffer from anemia. Since 2000, the production of oxymetholone has declined, but it is still produced to this day by some pharmaceutical companies. And of course, it is also manufactured by illegal underground labs. And now, let's move to the structure and characteristics of Anadrol. Anadrol 50, also known as oxymetholone, is derived from the hormone dihydrotestosterone, or DHT. Although Anadrol is a DHT derivative, it acts in the body in a very different way, not like other DHT derivatives. This will be discussed later in this video. It is also classified as a C17 alpha-alkylated anabolic steroid. This means its chemical structure was modified by adding methyl group to protect the hormone during oral administration. Without this modification, its effects would be greatly reduced when taken in oral form. However, this same modification also puts stress on the liver. The half-life of Anadrol is about 9 hours. This means it must be taken frequently, at least twice a day, to maintain consistent hormone levels in the blood. However, some people use oral steroids like Anadrol only as a pre-workout booster. This can also be seen as a harm reduction strategy, allowing oral steroids to be used for longer periods. We'll cover this point in details when we discuss its application. The androgenic anabolic ratio of Anadrol is 45 androgenic to 320 anabolic. I will explain this in a second. The androgenic properties are simply the effects related to male characteristics. Things like deepening of the voice, increased body and facial hair, oily skin and acne, or aggression. But the anabolic properties are the effects that support growth and repair of tissues, like muscles and bones. Things like increasing muscle mass by promoting muscle protein synthesis, improving bone density, and helping the body recover faster from workouts or injuries. All anabolic androgenic steroids have both androgenic and anabolic properties, but the ratio varies with each compound. This ratio is always compared to testosterone, which has a ratio of 100 to 100. Anabolic androgenic steroids were created to increase the anabolic effects and reduce the androgenic effects to minimize side effects. However, remember that the anabolic androgenic ratio comes from lab experiments on rats, which don't always translate perfectly into the real world. This is why I consider the anabolic androgenic ratios to be just a guideline, and I don't take it very seriously. And now, let's discuss Anadrol side effects. Anadrol is classified as an anabolic steroid. However, as we mentioned before, the anabolic androgenic ratio cannot be taken 100% for granted. That said, the androgenic side effects are very possible when using Anadrol. These side effects may include acne, body or facial hair growth, or increased hair loss, especially in individuals with a genetic predisposition. For this reason, this drug should be completely avoided by women, as the potential for virilization symptoms is pretty high. The androgenic side effects of Anadrol might come from its tendency to convert to DHT, which is quite strange considering that Anadrol is already a DHT derivative. It is worth noting that Anadrol is not 5-alpha reduced, meaning the conversion to DHT via the 5-alpha reductase enzyme cannot occur. As a result, using medications like finasteride won't prevent this conversion at all. Additionally, Anadrol may convert into a more potent androgen called 17-alpha methyl dihydrotestosterone, which could be the reason for its pronounced androgenic nature. This supports the idea that the anabolic androgenic ratios don't always reflect the full picture in the real life. For estrogen-related side effects, Anadrol is a really weird compound. Although Anadrol is a DHT derivative and by no means can convert into estrogen, it can still cause estrogenic side effects. And the real reason is not fully understood. There are a couple of theories. Some suggest that Anadrol acts like a progestin, meaning it binds to the progesterone receptor, which like nandrolone does. Progestins and estrogens can have very similar side effects. These can include developing gynecomastia, water retention, high blood pressure, or even potential body fat increases. Another theory is that Anadrol may activate the estrogen receptor directly. We really don't know the exact mechanism. But here is the most important point. Using aromatase inhibitors like anastrozole, also known as Arimidex, will not reduce or manage these estrogenic side effects. This is because Anadrol is a DHT derivative and cannot aromatize into estrogen, unlike compounds such as testosterone or dianabol. To control these estrogenic side effects, using SERM, which is a selective estrogen receptor modulator like Nolvadex, also known as tamoxifen, would be effective. SERMs in general work by blocking estrogen receptors and inhibiting their activation, unlike aromatase inhibitors, which work by inhibiting the aromatase enzyme responsible for converting androgens into estrogen. Before we move to the next point, which is Anadrol's impact on the liver, if you found value in this video, please give it a like and subscribe to the channel and hit the notification bell so you will get notified when I upload the next videos. And now, let's talk about Anadrol's impact on the liver. Anadrol is a C17-alpha alkylated steroid. This means it is chemically modified to protect the hormone during oral administration, which allows it to pass through the liver without being broken down. But these modifications comes at a cost. It puts a lot of stress on your liver, and you can expect that liver enzymes will increase significantly when Anadrol is used. This is why it is strongly advised to use liver support supplements and limit Anadrol use to short periods, typically around 4 to 8 weeks at most. But we will cover its usage and application later in the video. I have also to mention that Anadrol can also be found in injectable form. It is typically produced by underground labs, but even if it is taken as an injectable, Anadrol is still C17-alpha alkylated compound, which means it will still stress the liver. Regards its cardiovascular side effects, all anabolic androgenic steroids, especially orals like Anadrol, are harsher on lipids compared to injectable anabolic androgenic steroids. They tend to decrease HDL, which is known as the good cholesterol, and some of them increase LDL, which is known as the bad cholesterol. Surprisingly, even though Anadrol is considered a potent compound, research has shown that it doesn't increase LDL significantly, unlike Anavar does, but it still reduces HDL in a significant way, but not severely as cholesterol does. Also, high dosages and prolonged use of anabolic androgenic steroids can lead to left ventricular hypertrophy. All these side effects can significantly increase the risk of cardiovascular diseases. Also, Anadrol can raise blood pressure in a significant way. This happens because it can cause high water retention, and also it increases the red blood cell count. So, it is essential to monitor your blood pressure on a regular basis when using Anadrol, and be sure to keep it under control. And now, let's talk about testosterone suppression when using Anadrol. I know beginners find it easier and more convenient to take oral steroids instead of injecting. But in my opinion, Anadrol is not suitable compound at all for beginners. It is more appropriate for experienced users as it is really potent compound. And also in my opinion, an Anadrol-only cycle doesn't make sense, as Anadrol will suppress your natural testosterone production to a significant degree. And testosterone is the primary hormone that your body relies on for proper function. Its suppression affects the production of other hormones like estrogen and DHT. These hormones are very important for your body to function properly, and they also play a big role in the muscle building process. By suppressing your natural testosterone production, which will eventually happen even if it takes a little longer with Anadrol, unlike nandrolone compounds, which are very suppressive and can shut you down pretty fast, you will end up with lower estrogen levels. And as a result, you won't get the most out of your cycle. Plus, you will experience low estrogen side effects. This is why testosterone should always be the base of any cycle. Now, if someone is trying to avoid injections and relies only on oral steroids, my honest advice is to avoid taking the route of using anabolic androgenic steroids altogether. In general, it is most likely that natural testosterone production will return after using Anadrol, especially if you follow it up with a post-cycle therapy or PCT. But without PCT, you may still recover, but it could take much longer. So, in my opinion, taking PCT is a better option, instead of rolling the dice and see if your natural testosterone production will return on its own. However, if you are planning to use anabolic androgenic steroids long-term anyway, in my opinion, is that going back to TRT is a better option, because after years of cycling on and off, you will likely depend on TRT anyway. And now, let's talk about the dosages of Anadrol for medical conditions and how it is commonly used among athletes. You will be very surprised now as we discuss the prescribing guidelines for treating anemia. The dose is 1 to 2 milligrams per kilogram of body weight per day. That means an 80 kilogram person, which is around 176 pounds, can take up to 160 milligrams of oxymetholone per day for a minimum of 3 to 6 months straight, which is a really high dosage and for a very long period. However, when you look at athletes, they tend to respect this drug and treat it with caution. It is rare to see someone running it at such high dosages. The most common dosage for athletes is around 50 milligrams per day, sometimes going up to 100 milligrams per day. Of course, some users might push it higher, but that is not very common. In general, Anadrol has a different applications depending on the user's goals. Some users like to run it as a pre-workout booster, especially on days they are training lagging body parts, as Anadrol is well known for its ability to increase strength. Therefore, it is commonly used in powerlifting and the strongman sports. Other users like to include it at the end of the cycle during the off-season. This is typically the last 4, 6, or even 8 weeks to push size and strength gains. Anadrol is also used in contest prep, especially during the peak week before a show. I have to note that this practice is risky and requires you to be extremely shredded. Otherwise, you will risk looking watery and you may spill over. For this reason, if you plan to use Anadrol in a peak week, you need to test it in advance to see how your body reacts, because The last thing you want is to ruin all your hard work during contest prep. Also, I have to mention that Anadrol is very well known for reducing appetite. This can negatively affect you during the off-season, as it might make it harder for you to eat enough. And that is a big problem because without eating, you can never grow. Another thing to keep in mind is that Anadrol adds size very quickly, but a big portion of that will be from water retention. These days, many users don't like this watery look. This water retention can also make it harder to assess your physique, as it can blur your definition. But once you stop the cycle, you will lose that water. This is completely normal, so don't think you have lost muscle and get discouraged. I'm not saying it is a bad compound at all. I truly believe Anadrol is a very good compound and has its place. I am just explaining the pros and cons, so you can keep these points in mind when deciding whether to use it or not. Let's move now to its availability and supply. Anadrol is still produced by some pharmaceutical companies. The most famous brand is Anadrol 50 in the US and Anadrol-only in Turkey. And of course, it is also produced by underground labs. It is mostly available in tablet form with a standard dosage of 50 milligrams. Some underground labs even produce an injectable form, also dosed at 50 milligrams. You will find it under different brand names in the market, such as Anadrol-only, anabolic, Oxymetholone. These are just brand names, but the compound itself remains the same, Oxymetholone. If you found value in this video, please give it a like and subscribe to the channel, and click on the notification bell so you will get notified when I upload the next videos. For online coaching and consultations, please check out my website. You will find the link in the description below. Thanks for watching and see you in the next video.